All right, let's get right into it. Have you ever wondered how medical professionals ensure absolute safety when they're handing out medications? Well, it all comes down to treating medication administration exactly like a pilot's pre-flight checklist. It is non-negotiable. So let's break down this explainer and see just how rigorous this process actually is. We're going to walk through an entire shift of safety protocols together today. We'll start with the golden rules of meds, decode the medical alphabet, move into step-by-step symptom protocols, and wrap it all up with the crucial final step.
First up, Section 1, the golden rules of meds, establishing our baseline protocol.
So, there's a super strict rule of 3 for hand hygiene here. In this environment, washing your hands isn't just, a polite suggestion or a good hygiene tip. It is an absolute essential requirement. The protocol specifically says you wash before passing medication, during the passing of medication, and right after. It has to become this ingrained physical habit because it's literally the first line of defense for patient safety.
And it's not just about handing out the right pill. It's about how that pill is housed. Medications absolutely must stay in their original pharmacy-supplied containers. They have to be locked up in a cabinet or drawer. And if a med needs refrigeration, that rule has to be strictly followed, no exceptions. The whole point is to guarantee the medication's integrity is never, ever compromised before it gets to the resident. Moving right along to Section 2, decoding the medical alphabet, basically translating the secret language of caregiving. Now let's talk about the actual tool caregivers rely on out in the field, the MAR Guide, which stands for Medication Administration Registration. The sheer amount of detail on this thing is wild. It tracks the full name of the drug, the exact dosage, the precise time to give it, the route of administration, and the caregiver's signatures. It is a highly structured grid, and it's designed that way to leave absolutely zero room for ambiguity.
While looking at these guides, you're going to see the abbreviation PRN constantly. This is super critical. It means the medication is only given as needed or whenever necessary for a really specific medical issue. It basically requires the caregiver to use their best judgment based on the resident's current symptoms. But, as we'll see in a second, that judgment is always backed by strict protocols. Here's where you see how easily things can go sideways if you don't know this alphabet. Take AC, which means before meals, and PC, which means after meals. If a caregiver mixes up AC and PC, that's just a one-letter difference, right? But it completely changes the timing of a patient's medication around their food, which can drastically affect how their body absorbs or handles that drug. We see the exact same high stakes with measurements. Getting a TSB, a tablespoon, mixed up with a TSB, a teaspoon, isn't like ruining a batch of cookies. In a medical setting, that's a flat-out emergency. Think about it. Giving a tablespoon instead of a teaspoon literally means giving 3 times the intended dose of a liquid medication. The precision of this language is absolutely everything. Caregivers also have to memorize this rapid-fire shorthand for how often to give a drug. You've got STAT, meaning do it right now, immediately. Then the daily ones, BID for twice a day, TID for 3 times a day, and QID for 4 times a day. It's this rhythmic, coded language that keeps the entire facility running on a very precise clock.
But what if a medication isn't given? Well, there's a whole separate alphabet for that. They use R if the resident legally refused it. H means the resident is at the hospital, so the meds stay in their pack. And X means a PRN medication just wasn't needed that day. Literally, every possible scenario has a designated code.
Okay, Section 3, step-by-step symptom protocols and how caregivers use active decision-making. Don't just think of this as a boring list of rules. Think of these as high-stakes, real-world scenarios. The training maps out exactly what to do. Patient showing anxiety, like being combative or restless. The designated med might be lorazepam or Ativan. Got a fever over 99 degrees with sweating? Give oral Tylenol. Nausea or vomiting? The protocol points straight to prochlorperazine. But here's the kicker. Giving the drug is not the end of the line. You then face a really critical choice.
Did it work? That simple 2-word question really drives home the point that administering the medication is only half the job. Intense, ongoing observation is the other half. You have to actively monitor that resident to see if those symptoms actually go away.
And if the answer is no, if the protocol failed and the symptoms are still there is absolutely zero guesswork here. The manual is incredibly clear. The immediate, non-negotiable next step is to call the manager, period. The whole system is built to escalate problems instantly, rather than having a caregiver try to improvise a medical solution on the fly.
All right, Section 4, the crucial final step, the art of documentation.
Filling out an individual medication log is not just some casual end-of-shift paperwork. You need 6 exact pieces of info for total, unbroken accountability. You need the medication name, the exact dosage, the label instructions, the exact time it was given, the caregiver's initials, and any record of the resident refusing it. If you miss even one of those elements, you completely break the chain of safety.
On top of that, caregivers have to take meticulous notes on the MAR for any special instructions from the licensed prescriber. It has to clearly show if a medication is PRN, like we talked about, and it needs to call out physical instructions like, hey, this pill needs to be crushed, or this has to be mixed with food so the patient can safely swallow it.
And timing. Timing is everything. The rules explicitly say that you cannot wait to sign off until the end of the day when you're sitting at a desk. Caregiver initials must be entered the absolute second that medication has been administered to the patient. It prevents memory lapses and guarantees real-time accuracy across the whole facility.
So, I'll leave you with this final thought, which is basically the ultimate unspoken rule of caregiving. If it isn't documented, it didn't happen. Think about the weight of that. This entire system, the hand washing, the alphabet, the strict protocols, the immediate logging, it all exists to protect highly vulnerable people. So ask yourself, how safe would you feel knowing that one missed initial or one misunderstood abbreviation could completely change someone's life?